Flashback 1 year ago, did we even know what PPE stood for? Or how about that phrase we use so often now, social distancing?
COVID-19 has changed all of our lives and taught us a lot, especially those on the front lines. Tonight they're weighing in on the key takeaways, what they learned, and what comes next in this pandemic. Mike Pelton with the story.
By no means is the pandemic over, but it's a chance to learn from the past year.
How profound it is that social inequity kills people.
Several top doctors with Mayo Clinic talking takeaways.
Disadvantaged populations have essential jobs whereby they can't work from home, which means they're at higher risk for exposure. They're often overcrowded at work and at home.
The one thing that I wish I knew before, right now, is that how long this pandemic would last.
Dr. Alisa Shapital is the hospital medical director with Mayo Clinic in Arizona. She knows all about capacity constraints.
We developed models to do that where we could take care of a patient in a pre-op type of fashion in the same room to an ICU fashion, all the way down to a med-surg fashion. And I think that concept is how you build the hospitals of the future, right? Doesn't make sense to move patients all over the hospital as they change their acuity.
Frontline workers at all Arizona hospitals coming down from the second COVID surge over the past year.
It's really been a blur over the last year and how quickly we've done this.
Dr. Chris Samadar works at Honor Health Shea on the front line since the first patients.
To your point about early mechanical ventilation, no, we're not doing that at all. We're doing the opposite and trying to keep them off the ventilator as long as possible.
Much has changed over 12 months. Now there's recommended medications and therapies. A big step since last spring. Remember the coronavirus outbreak on the cruise ship and the chaos in New York.
We have this stress level that has just fluctuated based on, are we in a surge, are we not in a surge? The unanswered questions regarding treatments, what works, what doesn't work.
Dr. Samadar says in retrospect, better preparation probably applies to everyone, but he calls it an honor to serve in a pandemic that started early 2020, ending TBD. Mike Pelton, ABC 15, Arizona.